أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another class in our diploma for Hijama Coping Therapy here at Shifa Holistic Healthcare Limited, Kaduna, Nigeria. Today we're going to be talking about performing Hijama, preparing your patient, and what you really need to have in your therapy room, in your facility, to be able to cater for various treatments that you would be doing using hijama. Firstly, you need a bed. The bed could be like this. It could be fixed. This is a foldable, collapsible bed that could be moved around. However, you might be in a position that you have only a fixed bed, but you need a bed where your patient would lie down. This bed would have a facility like this for face. The face placement while the patient is lying down on his or her stomach, face down, for ease of breathing and growth. In this particular bed, you notice that there's an extension at the head where, should the patient need or there be need, the patient would lie down with the face on that protrusion there, the face to stay comfortably, and space for the arms. Now, this would facilitate for a patient lying down for treatment. Here today, while we're going through this, I have here with me Malan Abdurrahman. Malan Abdurrahman is one of our therapists here in the facility, and he's also an instructor in Hijama Coping Therapy. He will be assisting through this program today for us to show you how you would set your patients. Now, after having a bed, you would need a chair. A chair like this chair here. You need a chair like this where the patient would sit on to be treated either from the back where you want to put your cups on the back of the patient, or the patient could sit where you have to put cups in the front part of the patient, depending on what you're treating. Now, chairs come in very handy because some patients might not be very comfortable lying down flat on their tummy. Either they're just not comfortable, or they have an ailment like females with fibroids or people that are quite well endowed with body fat. They A simple dining table chair or office chair without arms will do. On the other hand, you could use a stool. You could see this stool comes in very handy when you're treating patients who cannot lie down flat on their backs or on their tummy. It becomes very cumbersome. So you would also need a rack or a trolley that you would keep your materials, your cups, your gloves, your disposables, needles, and a lot of things like that. Generally, we give our students a kit when they come for practical classes. The kit comprises something like this. The kit we give our students when they come in for the practical classes is something like what you have here on my right hand side. The packaging might be slightly different depending on what is available at the time, but what it contains is, you have here Yes, but what it contains are those things listed that are necessary for a therapist to have as he or she goes into treatment. It comes with surgical alcohol or methylated spirit. It comes with a cup that could be used for fire cupping. In some cases, you find out that we just give the plastic cups where the patient is not into fire cupping. It comes with wipes. It comes with cotton. It comes with gloves, which might be packaged differently from what you have here. The kit could be packaged differently. It comes with a container that has oil that is used for the cupping massage, and it comes with needles, lancet needles that are used for making insertions in the body. Like I said, it could be packaged differently. This is one of the kits we use in the facility, which is a high-end kit that comes also with a special tool that is used to make incisions on the patient. So you don't use your hands, you don't use surgical blades, nor do you use razor blades. This comes in, and this is also equipped with silicone cups. Uh, on the other hand, it could be done using vacuum cups. But basically, a kit like this would go to each student that comes into practical with a set of cups. This plastic cups that the pack comes with 24 cups of different sizes, and they also have magnets. So if you want to treat using magnets, they also have it comes with this hose to allow for cups to be put in comfortably. We'll go into the why and how of that as we progress further on this. So these are must-haves in your clinic. It could be different from what we have here. Your bed could be different. Your sitting could be different. You could have different types of chairs. But basically, these are things you need. So now we would show you how the patient would be placed in today's class. In the next class, inshallah, we would actually start going on to the hijama itself. So, inshallah, Malam Abdurrahman would assist to show how we would be putting our patients, how our patients would lie down for various treatments. Malam Abdurrahman, please. So now Malam Abdurrahman would take a position of lying down. Now, this is how you put your patient. Now, treatment here would involve the sunnah points on the head, sunnah points on the back, and points that you would be using from treatment for spondylosis to bronchitis to pneumonia to kidney infections to so many things, fertility related issues. You have points that you might need on the leg area. So the patient lies down flat like this. Where the patient cannot lie down flat like this for whatever reason, then of course there is a need to put the patient on a chair. Now, Madam Abdurrahman, please turn around and lie down on your back. No problem. Now, the patient would lie down flat on his or her back like that. For treatments that involve fertility related treatments where you might want to put in cups here, or other treatments where your cups would be in the front of the body. Now, like we said, not all points for hijama. That's the explain why and how, which to cup, which to dry cup, and which to wet cup. Inshallah. Thank you, Mala Brahman. You can please stand up. So, basically, your bed takes the patient like that. Now, let us look at the sitting patient, where the patient sits and you need to treat the patient. Mala Brahman, please. So, your patient sits, there's a provision for comfort for the neck or the face. It still allows you to treat sunnah points of the head, back. It allows you to do the cupping massage on the back and treat the patient comfortably. This is a comfortable position for people who have certain ailments that will not allow them lie down flat on their tummy or have discomfort lying down. We'll go into those kind of ailments later. Now, please, Mala Brahman, sit the other way. So, if you want to treat the person front, the person can sit back. You can adjust the headrest for the patient to sit comfortably while you put cups in the front part of the body. So, but where you don't have this, what do? You improvise. So, your patient could sit on a stool like this. Mala Brahman, please. Your patient sits on a stool like this, and you have the back to treat, or the patient might even put his or her head, lean on the bed, and you treat comfortably. You can still do your cupping massage, and you have access to practically all the points the patient needs. Now, where you don't have that, too, you have a chair like this, you would still use this to sit, and you can still treat your patient from the back. So, inshallah, you find out that you can adapt to the situations that arise by improvising. Some of these equipment are quite expensive, especially here in Nigeria now with the current situation of exchange currency and things like that. But inshallah, it is something you can save for as you progress. Thank you, Mala Abdurrahman. Now, it is always good too when your trolley has a tire, so you can move it. It houses your materials and all the things you need to perform a very good session of hijama. So, inshallah, in the next class, we would have a volunteer and we will carry out hijama full session using the sunnah points. So you see how it is done, and inshallah, we pray you do better than us and you give the healing required as you progress in your treatment. Like we said, we're always open to questions. We're ready to give all support to our students and keep yourself in our groups so that you'll always be updated as we post in new information that would help. Wassalatu wassalamu ala Muhammadin wa ala ali Muhammadin kama sallaita Ibrahim wa ala ali Ibrahim fil alamin innaka Hamidum Majid. Thank you very much for attending today's class. See you in the next class, inshallah. Assalamu alaikum wa rahmatullah.